Taking us higher. Step inside, don't be shy tonight. We're connecting hearts live on the mic. Let's talk, let's talk, let's talk. Everybody come and let's talk, let's talk. We got stories, let's talk. We got stories, let's talk. Let's talk. Ooh, yeah. Let's talk. Ooh, yeah.
Hello and welcome to The Talk with Tariro. On the program today, we have one person that would call our resident oncologist on The Talk with Tariro. That's Dr. Nyakabau. Doc, welcome to The Talk with Welcome back
Thank you
to
very
The
much.
Talk with
Yes,
Tariro.
yes.
We've invited Dr. Nyakabau to talk about an initiative that's going to be launched where we're talking about threads of triumph. And she's going to unpack that for us. At the moment she's always here, we always talk to her about our own situation as a country, a situation that we are grappling with on a day-to-day basis, the deadly C, the deadly cancer, which is taking a lot of our close relatives, parents, sisters, neighbors. We are losing a lot of people to cancer. So we'll also tackle that with the doctor. So, Doc, as we start, let's hear around the threads of triumph. What exactly are we talking about?
Let me take you back. Indeed, you call it the deadly sea. But when you see survivors, people who come to see me once a year, just for us to be talking about anything and everything, and they were cured of the deadly sea 20, 30 years ago.
Serious?
Many people don't believe. In
Yeah.
fact, yeah. You know, my hairdresser was like, I've never seen anyone who is living after a cancer diagnosis. Exactly. That really made me think that there's need for something to be done
Yeah.
to make sure that at least people can really see and listen to people telling stories of having survived this disease. So me and the people that we work with at Cancer Save decided that we should have a dinner where we honor the people who are with lived experiences of cancer, so that when we honor them and they speak to the nation, people will then see that, yeah, indeed, this disease is not as deadly as we call it. All we need.
You are seeing my face.
Yes. Yeah.
Because it has and it continues to take a lot of our people.
Yes, I think it's because there are lots of myths and misconceptions around that make people shy away from what actually they should get so that they can overcome this disease. So it's the people themselves, and perhaps also we need as a nation to come together. The numbers are just way too much for any stakeholder
Yeah.
to be able to handle the disease on their own.
Yeah.
So we need to come together so that we can put our heads together, put our monies together, rally behind the plan that the country has so that we can deal with this disease.
Yeah. And when we are saying threads of triumph, what's the idea behind coming up with that theme is what you are running with?
Thank you very much. You know, I believe we can really actually be triumphant against this disease. And when we look at the bravery that people who have been treated with this disease show, they are the ones that give us something to hold on to say, oh, yes, something can be done. And this disease, you can actually be alive. They also are threads of triumph for those who actually have been recently diagnosed and they are going through their treatments, many of them actually go and talk to the patients who are going through their treatments, and you find that at the end of that, the patients can relate with them.
Yes.
The difference between the healthcare workers talking to the patients or those who are being treated is that they will be like, you don't know
Yeah, the
what
doctor
how it
said,
feels.
exactly.
Yeah, you are only a doctor. Yeah, only a doctor. You don't know what I'm going through. Whereas when they talk to survivors, they can actually relate and say, oh, and they've got their own actually tips that maybe even in the medical field, we may not really be conversant. And you find that the patients will then sell. So they are the threads of hope for the patients. They are the threads of hope for the nation. They are the threads of hope for even the healthcare workers.
So from what you're saying, Doc, you're saying we actually have survivors who have lived for more than 20 years after being cured.
Indeed, there are survivors who were coming to see me before I even became an oncologist. I've been an oncologist for the past 30 years.
So they are still there.
Yes, they are going. They only think of their disease when they come for review, and also they want to come and say hi to their good doctor.
So when you say someone has been cured, are we saying it will not come back? Or are they in remission where there's the danger of it popping up later on? Maybe enlighten us around that.
Okay, so when we say the disease has been cured, what it means is that someone, it depends also on the stage, how far gone the disease is. But we usually refer to the 5-year time for most of the cancers. So if someone has lived after a cancer treatment for about 5 years, the chances of the cancer coming back is way too low that when we talk in statistical terms, I'm now talking statistics.
Yes.
The chances of it coming back is almost zero.
Really?
And then you say, practically speaking, they have been cured. But it depends on the type of disease, the stage of disease.
We have Dr. Nyakabau here. We are talking about Threads of Triumph, an event where cancer survivors are actually coming to encourage, I wouldn't want to just say a few, but to encourage us as Zimbabweans to say this deadly sea that is wreaking havoc in our country, wreaking havoc globally. They are survivors, and that in a way tries to give us hope. Join us after this break. Welcome back. We continue with our discussion. We have an oncologist on the program. That's Dr. Nyakabau, who is one of the key medical practitioners here in Zimbabwe when it comes to dealing with issues of cancer. Doc, my key question to you, when we're looking at cancer in general, these days, you hear so-and-so has been diagnosed with cancer. 2 months down the line, they're gone.
Yeah,
That it has become quite prevalent. What is happening?
yeah. Thank you very much for asking that question. And I don't know how I can tell our people that, time is money when it comes to the diagnosis of cancer. In fact, let's say that, we don't even have to wait for a diagnosis. For all of us, we need to know about cancer so that we can then say, how can I prevent getting cancer? Because prevention does not cost anything to the nation. And then the next stage is, screening. What is it? What is my risk for any disease? Being a woman, have I had any cancer screening for mouth of the womb, or what they call the cervix,
Yeah.
or even breast cancer screening. How do I check myself? Breast examination, and also when I get to the right age, like 40, if I started having mammograms. So it's kind of like I'm taking care of myself, I'm knowing myself, because when you know you're normal, when there's something that is abnormal, it then rings a bell that you should go and get checked. And then you get checked when there's still time before things have established themselves.
Doc Manj, what's happening? You've spoken about cervical cancer, breast cancer, and I think for men it's prostate.
Yes.
Those are the cancers that we are always told go and be screened. But manje iye zvino uri kunzwa munhu akungonzi unenge uchatonzi cancer yechigumwe kwangonyuka idzodzo dzokuti hadzisi hapana munhu anenge achienda for all these, but pane kahwani kari kungouya kobva kanzi une this type of cancer and munhu akutonzi in a month munhu zvakubva kupi dzakubva kupi idzi dzamanga musingambotauri, because pese pamunotaura yebreast cancer tinotoziva tine mamonths atinonzi aya akati breast cancer awareness month, and ai munoscreenwa vanhu vachienda vachinoskrinwa, but iye zvino it looks like yakubva kubreast ikoko, yakubva kucervical, yakuenda kungonzi ane cancer yechiropa, ane cancer yechakati, zvangowanda-wanda. Zvii zvakuitika?
Okay. If you want me to answer you in Shona.
Yeah, I think let's go into Shona as well to assist vana mai vana mbuya, because ndo dambudziko ravapo iroro.
When you talk about cancer, we've got over 200 different kinds of cancer. The reason why we focus on the ones that we focus on is because those we're talking in terms of numbers.
Yes.
And when you talk in terms of numbers, and also when you talk in terms of, all right, if you look at cancer of the cervix, cancer yakuti, it's highly preventable. It can be screened and got rid of. It's also highly curable.
Yes.
And globally, kune dzimwe nyika dzekuti ma numbers cervical cancer atodzika to something that you can not even talk about.
Yes.
It's like 4 per 100,000. So isusu tiri kuti tikadzikisa malevels edzatinoona kuti idzi tinogona kudzikubata early, zvinoreva kuti tinosara neshoma dzatinodhila nadzo. So if cervical cancer actually contributes about a third of the cancers. Eliminate iyoyo, unoza mari yatiinayo inenge iri shoma iyoyo inenge yoshanda kune dzimwe dzatisina kunge tacontrola.
Yeah.
Saka it's so important that we still maintain our focus on these ones that we already know, but also it doesn't mean to ignore dzimwe. We also then can see the other patients vanenge vaine dzimwe cancer. Bowel cancer, for example, iri kutaurwa zvakanyanya mazuva ano. There is quite a lot of it affecting even younger people as well. Dietary things, ma-infections anogona kunge achikonzera cancer. Radiation chaiyo kana dzimwe nguva diet, ndataura nezvediet.
Yes. Kuti zvatinodya zvinogona kukonzera cancer.
In terms of tikange tichidya zvinhu zvisiri healthy.
Sezvipi dokuchitoti udzai baba?
Zvinhu zvakaita semafuta akawanda, shuga yakawanda, even
zvinofumudza.
Weight ikanyanya kuwanda, fat yakawanda mumwiri, zvinogona kuita kuti zvinoencourage kuti cancer ikure. Saka tinoda kunge physical activity also. Someone like you look very nice and trim. It helps to discourage the growth of cancer. Tataura ma-infections futi. Cervical cancer inokonzerwa nevirus inonzi human papilloma virus. Mamwe ma-infections akaita se-HIV and AIDS anoita kuti cancer immune system ikaderera. It means the cancer is more likely to develop and grow. So if people take their antiretroviral medications, get their screening, the chance of the cancer progressing or getting it is reduced as well.
Then Dr. Tarisa isusu kuti all these other cancers, I would say maybe 90% of the time, when you diagnose them as doctors, it's almost too late. Munatowapa final stage.
It's very, very sad that, because cancer hairwadzi. saka people will not go. So it's only kana dai zvainzi inorwadza kana kuti inoshowa through bleeding then people vanhu vedu we are so reactive as opposed to being proactive. So you find kuti munhu anozoenda when there is something chiri kushowa kana kuti ibundu kana chii. A lot of times most of the journey yecancer kubva painotanga kari katikitiki kusvika yaakuratidzira it can be 10 years or more. Saka patinozoiona kazhinji kacho it will be advanced, and when it's advanced it means inonetsa kurapa nekuti yadzika midzi yatandira uyezve kana yatandira kudaro there are different versions of the cancer. When it happens, handiti tinotarisa kana Adam na Eve, they were related, and then as time went on you got people who are unrelated. So ndozvinoitikawo pacancer, the cells initially they are related such that when you treat them, in fact initially you can even cut the tissue round obvisa cancer inenge iri small, it's easier to operate. But kana yakura now, you also have different versions of the cancer. And when you give a treatment, some of the versions may respond, the other versions may not respond. Ndo panozonzi vari kutamba nenguva yangu havana kundipedza chirwere changu, things like that.
Yeah, we will continue with the doctor after this short break. I'm sure a lot of us, this discussion is quite pertinent, quite interesting for us, because these are the day-to-day issues that we have to deal with. Join us after this short break. Welcome back. We continue with Dr. Nyakabau, and we are discussing issues of cancer. There is an upcoming event, Threads of Triumph, where we have cancer survivors and sharing their journey and how they actually overcame cancer. Doc, so idzi dzacho dzisingaoneke mataura kuti hairwadzi, saka haisi kundirwadza. Chero ndikauya ndikatestwa haisi kuonekwa, saka toita sei? Because tatopererwa, saka todii isusu sevanhu, because hapana chiri kurwadza. Ndoita sei manje?
Okay, so kazhinji kacho tine means and ways dzekuona cancer isati yakuonekwa. Handiti ndosaka tichiencourage vanhu kuti endai kumamammogram. Handiti mammogram inoona kacancer kasati kari katikitiki kasingaoneki kasingabatiki. So if we diagnose, tikaona cancer iyoyo tikaidiagnosa, treatment yacho kazhinji kacho, if it's a breast cancer, it means you just maybe remove it. Haubvisi futi zamu. So there is no need for removing the, because madzimai
apa handisi kuda breast cancer doc, ndikuda dzimwe idzi dzakungobatwa iko zvino yekuti pancreas munoiona sei? Hanzi pauro cancer of what? Idzodzo
even ma-CT scan, ma-MRIs, tine ma-tests
dzinoona.
And also sometimes even tikatora ma-blood tests, you can be able to tell
there's something wrong.
It's like,
then
you
do further investigations.
Yes, like dziripo dzimwe like ma-gestational tumors, vana choriocarcinoma, which is highly curable as well, but very rare. But you find kuti munhu akatorwa blood, pane inonzi beta HCG hormone inouya inowanikwa mupregnancy, inobva yaratidza zvakanyanyisisa such that munhu iye akabatwa anotorapwa yobva yati gwa.
All right. Mati munoencourage mammogram, munodi tine ma-myths and misconceptions. I don't know whether there are myths and misconceptions kana kuti chokwadi chokuti munhu anenge achiti zvanzi mukangoramba uchingoenda uchingoiswa pamagetsi iwayo futi zvinotokonzera futi cancer, ikuti ndingoya every year muchingondivheneka hanzi zvinosumudza futi cancer, iwo magetsi amunenge muchitiisa aya.
Aiwa, saka tinotaa kuti isusu in life tinotarisa the risk versus the benefit.
Yes.
Apa hatisi kuti isusu munhu uri kuuya mangwana munoitwa mammogram. No, zvinenge zvakatoongororwa kuti you know what, when we are giving madoses emammogram, and mazuva ano futi mamammogram acho aako ane technology yekuti the radiation inopinda pamunhu is very small, it's even smaller than dzekudhara. So zviri kuimprova zvese izvozvo. Kwane digital mammography yekuti there is not much radiation, and it has been weighed and actually calculated that the risk is not significant enough to cause cancer. So you are better off getting the possible cancer diagnosed than fearing to go for mammogram. Besides, inongoitwa from about 40 years and above. Haiitwi munhu wese. Vanenge vari younger vanoitwa ma-ultrasound scan.
I'm sure we have learned from what the doctor is saying, because half the time we try and avoid going for those screenings, tichichka, all these things. But the doctor is saying that when we're weighing the risk versus the benefit, we're actually seeing good benefits. They are actually much more compared to when you actually don't go. We've got another issue, Doc, with cancer treatment. Munhu vaenda sefamily zvonzi munhu ane cancer, vanhu vari kudecide not to actually undergo chemo radiotherapy because hanzi ukangoenda zviana chemo zvenyu zvinenge zvitodhemeja munhu completely. Saka munhu onzi usatombobvume kuenda pamagetsi, ndozvatinotaura tichiita. Ukangoenda pamagetsi hazvicharapiki, but ukaenda kwasekuru chimuti uri kunosvika zvinorapa.
Ndinoda kuti nditi kazhinji kacho kusaziva, unfortunately. Maybe hatisati tanyatsoita maprograms akakwana kuti vanhu vanyatsodzivisisa zvazvo kuti matreatments aya zviri kurevei. Vazhinji kusatoziva, saka you'll find kuti vanogona kudecide kuenda elsewhere for treatment because they do not understand the treatments themselves. Matreatments aya ndo anotoshandiswa kune dzimwe nyika kwese vanhu vachitopora. Tinenge tichitrya kuita kill the multiplication, kuberekana kwecancer. But unfortunately, also some of our cells, they are also affected because they are multiplying to replace the cells. If you look at the blood cells, for example, they get hit in the way. And this is the reason why tichizoipa at intervals, so that we allow the normal cells to recover in between the treatments. And tinototanga tatora ma-blood tests kuti tione kuti my blood cells are recover here, so that we can then subject the patient to the next treatment. The same with radiotherapy. The only difference between radiotherapy and chemotherapy is that radiotherapy tinoshandisa ma-X-ray, and it goes to a local area, it goes to a specific area, unlike chemotherapy which travels through the bloodstream, kunoita affect the areas dzinenge dzine cancer. So that's the difference between the two. And unfortunately, we need to do more education. Some of the medications dzinoshandiswa dzisiri mainstream medication. Unfortunately, I cannot say what is it here. And also sometimes even vanhu vanorapwa, you don't even know kuti these people, were they really diagnosed cancer? Because for you to be said to have cancer, tinenge tatora kapisi kenyama yecancer koenda konoongororwa nema-specialists nema-tests anoitwa to confirm the diagnosis of cancer.
And as we try and wrap up the program, let's go back to Threads of Triumph. Where is the event happening? Who is eligible to come? Do we need to pay? Who is invited? What will be happening on the day?
Oh, thank you very much. This is just, June is Cancer Survivors Month.
Yes.
So this is a day where there will be dinner at Life Celebration Center, which is in Good Hope. And unfortunately, for any event to happen, you also need resources. We actually started with zero budget, but we were fortunate enough to be offered this venue free of charge by a benefactor. And I would like to thank her. Unfortunately, I can't mention her name, but she did a good thing for us. And, so the flyers will be circulating around where there'll be tickets to be bought. But we're hoping that we'll get some survivors that can come in without having paid anything, hoping that maybe there'll be some donors who donate tickets for cancer survivors, because since we're celebrating them, it would be ideal for them not to pay.
And what is your key message to Zimbabweans just as we wrap up around cancer?
Thank you very much. Cancer is a disease that can be prevented by all of us. And also there is hope in the sense that it can be detected early and it's curable if it is caught early. And let's actually try and do as much as we can to see to it that as a country, it takes you and me to see to it that we make cancer a disease that people are scared of.
Indeed, let's make sure that what I've just picked up from the good doc is with cancer, time is of essence. Early detection saves lives. Until next week, it's goodbye.
We got stories, let's talk. Let's talk. Ooh, we got stories, let's talk.
Morning light and the cameras rolling, people smiling, conversations flowing.
From the city streets to the worldwide view.